Okay. Well, first of all, can everybody hear me okay? Okay, good. Good morning, everybody. I can't tell you how wonderful it is to be here, to see all these wonderful faces that I know so well and love so dearly. Everybody's been talking so much about isolation, and I think that isolation is one of the biggest things that we've all had to deal with. And then, of course, we're going to have to deal with feeling comfortable going out again. And I'm not sure I'm ever going to feel comfortable not wearing a mask outside. But that's me, even double vaccinated, if I have to be triple vaccinated, whatever it is, I don't know that I'm ever going to feel comfortable again. So for me, that's a real negative concern. However, a mask is a mask. And if someone had not taken their mask off when they shouldn't have, then Derek would not have been infected, and then I wouldn't have been infected, unfortunately, by him. But let me tell you the story. I know most of you have been following what I've been saying on Facebook, and I want to thank you all for your wonderful, encouraging posts, and for your messages, your personal messages, your direct messages. I can't thank you enough. You are all my family, and I love you all. I can't thank you enough for everything you've done for me and Derek, and could not have gotten through any of this. I may be isolated, but I could not have gotten through any of this without the support and knowing that you are all there to help me. Because as you all know, it hasn't only been a terrible struggle for us since May, but you know, I've also had to go through some very difficult personal and professional problems, and which have had a massive effect on my emotional and psychological and mental health. So I never expected to be in this position. I'm the one that we were protecting because I have comorbidities. So I have a heart that has some different kinds of arrhythmias. One has been corrected by surgery. I suffer from asthma, and I get very bad upper respiratory infections. I've had the whole gamut of respiratory infections, upper and lower, including pneumonia, pleurisy, and stuff like that. So I was the one that we knew we had to be very careful about so that I never got infected. So from the start of the pandemic, I had been working from home for a while anyway, but from the start of the pandemic, we had become very much aware of public health protocols and everything that we had to do in order to protect ourselves and protect everybody outside. And being a counselor as well, I'm aware of the other side too, you know, concerning public health. So we had been so good from the beginning of the pandemic until May arrived. So April. So I was lucky because I had my first vaccine, AstraZeneca. I had my first vaccine on April the 15th, exactly 4 weeks before we became infected. And there can be no doubt that that vaccine most likely saved my life, but without any question saved me from severe, serious illness, catastrophic, severe, serious illness that happened to Derek. So Derek, unfortunately, hadn't had his first vaccine yet. He was due to have it the day after we were contact traced, and he started showing symptoms, and that was April the 19th. January, February, March, April. So March the 19th, I had had my first vaccination. Sorry, the months just blend into one another. So on the morning of April 19th, it was a Monday, we got a call to say that we were being contact traced because somebody that Derek had been in contact with had tested positive and was ill. So when this individual was with Derek a few days before, he had taken his mask off. Not when Derek was there, but before Derek got to where he was going. And we were all infected with the Alpha variant, which was the UK variant, highly transmissible and highly contagious. The Delta variant is that on steroids. So unbeknownst to Derek, he had been infected, and then he came home. And of course, the moment he walked through the door, I became infected. It can happen that quickly, but of course you don't know it yet. So that April the 19th, we got this call, and I immediately made appointments for us to go to Mackenzie Health to get ourselves tested. We'd already been tested a few times before because we thought maybe we had it, we were sick maybe, but they were always negative. But I knew once we got this call, we were in trouble. So we went to get tested, and Derek's test came back positive. Mine was still negative. And he started showing symptoms that night. 2 days later, 48 hours later, I started showing symptoms. So I went back to have another test at the Mackenzie Health Acute Clinic, and that came back positive. In fact, the doctor who saw me there that night, he said to me, we'll give you the test, but I can guarantee you it's going to be positive. Anyway, so that was the 19th to the 21st of April. So they tell you that that day 9 to day 14 of infection are the most, days 9 to day 14 are the most, can be the most dangerous. I'm not sure why, but I guess it's how the virus has accumulated in your body, and your body may or may not reach a tipping point. So I was ill. I mean, I was being taken care of by the outpatient acute respiratory care clinic at Mackenzie Health. They were absolutely unbelievable and wonderful to me. They brought me a sat monitor to monitor my oxygen saturation levels. They immediately started me on puffers, and I'd had an x-ray. I had no pneumonia. Derek was ill, but he wasn't very ill. Like I was taking care of him and making sure that he was okay. But June the 30th. So on we were on day 12 of his infection, because he was 2 days in front of me. So it was Friday. And I noticed during that day that his breathing was different. It had become very, very short and rapid. So I have enough medical knowledge and background to know that that's not a good sign. So I tried twice to get him, first to take him to the hospital and then to call an ambulance to take him to a hospital. But Derek, being my beloved Derek, is very stubborn. And as, with apologies to all men on the screen here, as men can be. So I watched him very carefully, and I could tell that his breathing was getting worse through the night. Also, Derek had spiked terrible fevers. I don't generally spike a fever no matter how sick I am, but Derek's fever had gotten well over 104 at some points. So he fell asleep in the chair in our bedroom, and I was awake because I was watching him. But at some point I fell asleep, and I don't know why or how. To this day, I do not know what woke me up. but I was woken at about 3:15 on the Saturday morning, May the 1st. And Derek wasn't sitting in the chair. Derek wasn't in bed. So it's a bit of a blur to me, but I realized, well, he must be in the bathroom. And I called his name a couple of times and he didn't respond. So I got up, I go to the bathroom, and he's in the bathroom and completely unresponsive, barely conscious and completely unresponsive. So I don't even remember how I got my phone in my hand. I managed to get him back to sit on the edge of the bed, and I had 911 on the phone. They were wonderful, most wonderful female operator. She kept me calm as possible, and told me every step of the way where the ambulance was. We are lucky because we live at Harding and Young, so we are minutes away from Mackenzie, and we are minutes away from the paramedic station, right? So I know that it took only minutes for the ambulance to get here. And then they come up, the paramedics come upstairs, and I was told to mask up, and I wasn't allowed to be anywhere near them because I was positive too, right? So they come in dressed like astronauts, and they were phenomenal. 3 paramedics. They just took control of the whole situation, took control of Derek, and spoke me through a few things, and then told me I could not come with, even if I wasn't positive. I had to remain here in the condo, and they would call me from the hospital. So it was shocking. It was probably one of the most shocking events I have ever experienced, because when they took Derek out, I was convinced I would never see him again. When they got him to the hospital, and I watched the ambulance go screaming up Young Street from my condo, lights blazing, I could hear the siren because it's 3:30 in the morning. And I knew Derek was in that ambulance, and see them turn the corner at Major Mackenzie and disappear. And I had to wait probably about 45 minutes, I think, before I got my first call. So when they got Derek to the hospital, his saturation level was 50. Now, your oxygen saturation levels must be well over 92% in order for you to be okay. Derek's was 50. And the doctor told me that it was remarkable that he was actually still alive. So through a couple of phone calls backwards and forwards from the hospital, they attempted to get they immediately got him on pressurized oxygen, but they couldn't get his saturation level above 70%. So they called me again, and they said, we have to intubate him. He has to get on a ventilator. We have to put him in a coma. We have to paralyze him, because that's the only way we can save him. And then the doctor said to me, I'm going to go back into his cubicle, and I'm going to call you again, because I need you to speak to him, because you may not be able to speak to him ever again. So she calls me back, and there was such a noise in there because of all the oxygen, but I could hear I could hear him moaning. I knew it was him. And the doctor, her name was Dr. Spring, wonderful woman. And she said, okay, I'm putting the phone onto his ear. So say what you need to say, and then we've got to ventilate him. So I told him I loved him. I said, the doctors are going to do everything they can for you. They've got to put you on a ventilator, and everything's going to be okay. And then I heard Dr. Spring say, okay, you have to say goodbye now. So I said goodbye, and I heard Derek mumble, I think it was goodbye, and the phone goes dead. So I know that he's being intubated and all of that, and he's going to be taken up to the intensive care unit. So I got another call probably about 45 minutes to an hour later, and they told me that he was safely in the ICU. He was intubated and they were going to do whatever they could. So what had happened was this. Whatever I had heard on television, like somebody on here said they hadn't really been watching television because they couldn't watch it anymore. But we became what I was seeing on television, these desperately ill people who were dying. And so they explained to me what happened was this. Derek had what's known as the cytokine storm. So the body is, because he hadn't been vaccinated, he had absolutely no immunity whatsoever to fight this unbelievable virus. So it makes its way through your system. It starts to multiply. And when it gets into your lungs, that's the problem, because that's where it loves to live and multiply the most. It's dark and it's wet, and it does the most damage. So the virus then reaches it, your immune system reaches a point of no return. And it's called, in fact, they said it's a tsunami, it's not a storm. So what happens is the immune system becomes so overwhelmed trying to fight the disease that it starts to attack the body itself, because it cannot distinguish between what's virus and what's lung tissue trying to fight the virus. And the problem with COVID is that it attacks the very, very small parts of your lung, the tiny alveoli, which are they sit at the edge of what look like clusters of grapes inside your lungs. And those are the end and the beginning of transfer of oxygen to the body and removal of carbon dioxide from the body. So when that becomes compromised, everything falls off the cliff. And that's what I saw. So I remember having one conversation with the one doctor. There were Dr. Chu and Dr. Spring were the two ICU doctors Derek had at Mackenzie for 10 days. And they both said to me the same thing, because I was beside myself. I should have forced him to go to the hospital. I should have done whatever I could to drag him there or to call an ambulance never mind what he's saying. But I didn't want to make the situation worse, because the more I said, Derek, we need to go to the hospital, then his breathing got worse because he didn't want to go to the hospital. So you're fighting this awful situation. But they both said to me, and including the acute respiratory care doctor who was taking care of me, they all said the same thing to me at separate times. So it has to be correct. And they said that put blame yourself here. It has nothing whatsoever to do with how you reacted. You actually did everything right. And by calling 911, when you realized he was in dire straits, that's what saved his life. So I had to get over that mentally, that perhaps if I'd gotten him sooner, perhaps he wouldn't have been so critically ill. But apparently no, it passes a point of no return. And that's why all these patients were and are in hospital. So they intubate them, they put them on ventilators, you are paralyzed, and you are put into a coma. So that allows the machines and the medication to take full responsibility for your body. So you're on full medical and life support. So Derek's first stay in the ICU on a ventilator was for 5 days. Now, they told me right at the very beginning, and when I think about it now, and I couldn't quite believe what they were saying to me, that he would be in the ICU for weeks and he will be in hospital for months. I remember when I heard this the first time on May the 1st, I thought to myself, that's impossible. How can that be? But that's exactly what happened. So he responded very well to the treatment. from the first ventilation. He was given monoclonal antibodies. They give them that for 3 days, works very well. Monoclonal antibodies used to be called interferon. If anybody knows about anything about the immune system and what people are given to boost their immune system, we have interferons in our immune system. So that's what a monoclonal antibody is. He was on full life support, full medical support, and full ventilation. So after about 5 days, he began to show some improvements. So they want to get them off that ventilator as soon as possible if they can, because the ventilator itself can be damaging, which we find out later. So, so he's managed to be weaned off the ventilator. I still haven't seen him because I'm still in my 21 days and York Region Health will not let me leave my condo. So I can't go there. No one can go there. So everything that I did was via the telephone, and the doctors at Mackenzie Health, they were absolutely unbelievable. They would call me 4, 5, 6 times a day and let me know how he was doing, even if it was bad news. But anyway, on the 5th day of that initial ICU visit, internment, they managed to extubate him. I was told that there was a 10% chance he would have to be re-intubated if his body wasn't actually able to breathe on his own. But Derek being Derek, he managed, and they managed to get him just on pressurized oxygen. And once the patients reached that level at Mackenzie Health during that period of the pandemic, they were transferred when they were stable enough to the new Cordalucci Hospital. So Mackenzie was taking in the emergencies, and then as they stabilized, they were being sent to the new Cordalucci Hospital, which, by the way, is unbelievable. So Derek was transferred via Orange Ambulance. Orange Ambulance makes these transfers of these critical patients because they are, unlike York paramedic ambulances, they are actually ICUs on wheels. So it's a 4-man team, and they do the 10-minute run. It wasn't a helicopter, it was ground transport. It's a 10-minute run. They put their lights and their sirens on, and they get taken from one hospital to the other. So he was then moved into the critical care ICU unit at Cordalucci. At this point, I was now past my 21 days, and I was able to go see him. So I saw Derek for the first time in ICU at Cordalucci, and he was getting better. He was improving. And Marge, I'm sorry if this goes a little bit longer than your scheduled time, but it's such a long story. So he was getting better. And so we're now at about May 24th. So it's 3 weeks. And literally within hours, Derek became critically ill again. So what happened was COVID pneumonia makes holes in the lungs. Bacterial pneumonia, which people generally get when they get ill, doesn't do that. Bacterial pneumonia situates itself in the lower lobes of the lung. You have 3 lobes in the one lung and 2 lobes in the other. And it doesn't destroy the lungs the way COVID pneumonia does. I've had pneumonia twice. I know I've got scarred on my lungs because of it, but I have good lung capacity, apart from having asthma. So what happened was he started coughing and he just couldn't stop. And they had to find out why. And then he started coughing up blood. So a whole series of events started happening. He's taken to CAT scan because it's not a portable CAT scan. It's a huge machine. He has an emergency CAT scan. He comes back to the room and he's having terrible difficulty breathing, even with pressurized oxygen. So they find from the CAT scan that he has a pocket of infection outside the lung on the lower right side. So the infection from inside his lung had leaked out into what's known as the pleural cavity. So between your lung and your rib cage. And that had irritated his diaphragm, which caused him to have this terrible coughing incidents and then start coughing up blood and just throwing up. So then they also saw that on the right side as well, there was an air pocket, no infection, but an air pocket had developed in the upper right area of his lung. So his right lung was compressed, it had collapsed. And because the left lung was unable to deal with all the stress as well, it collapsed as well. So a whole sequence of events happened very, very quickly. And Derek went into what is known as septic shock. So that's it's called an empyema. So the pleural infection was his body's last straw. His body just said, I'm done. I can't do this. And then the body goes into septic shock and you have multiple organ failure. And they called me and they said, I need to come back to the hospital, which I did. And they said they're going to have to re-intubate him because we were in serious trouble. So we did. So he was re-intubated. And then I came home. I knew he was in, the best care. There's nothing more I could do. And they wouldn't let you stay there for longer than an hour. Came home. And then it was about 1 o'clock in the morning on May 24th that I got another call from them. And the doctor, his name was Dr. Golan. He said to me, I should come back to the hospital. Derek was dying. So I called my sister and she came to get me because I knew I couldn't drive by myself. So she took me there. I was there for about 2 hours and I witnessed something I've never thought I'd ever see anything like this before. I saw my father in ICU. I saw my father in CCU, cardiac care unit. But I've never seen anything like this before. It was just organized chaos. There were doctors and nurses and machines and IV poles and and Derek lying motionless in the bed. And I got really upset. And so the Dr. Golan said to me, we felt it was necessary for you to be here. But quite honestly, perhaps you should rather go home, because this is too difficult for you to witness. So I stayed there for a little bit longer. And it was during this conversation that the doctor said to me, and I remember this conversation like it was yesterday. He said to me that Derek had a 5% chance of survival. So he must have seen the expression in my face, because he said, so I want you to understand that that means he has a 95% chance of dying. So I looked at him and I said, well, if you're going to throw 5% odds at anybody, throw it at that man lying in that bed, because he will beat it. And Dr. Golan looked at me as if to say, okay, she's definitely losing it. But I meant it. And I said, if there's one person who's as stubborn as a mule and who will not take no for an answer and will continue to fight like hell, it's Derek Christie. And that's what happened. I mean, they called him the miracle man. And even at the rehab hospital, they can't believe what he went through. So this time on intubation, on the ventilator, and full medical and life support was 9 days. And they told me the morning after, so May the 25th, they said that if his blood work comes back and it shows, it doesn't have to show any improvement, just as long as everything is the same, then that means he's responding to the treatment. So there were 5 IV poles behind him. There were 40 different medications being run into him. The oxygen, just everything. His kidneys had failed, but then they came back. And that morning's blood work showed that he hadn't deteriorated. So the doctor said, so we go another few hours. So when he was at Mackenzie Health, they proned him 3 times. So that means they flip the patient over and the patient lies face down to the floor. They did that 3 times with Derek. So for 14 hours out of the day, they prone them and then they bring them back and then they do it again. They didn't, and that's to relieve the pressure off the lungs. They didn't do that at Cordalucci because by now Derek had 2 chest tubes going into the right side, not 1, but 2, one to drain the infection, the other to drain the air. So they were so concerned about proning him that it would dislodge either the tubes or the ventilator tube, that they decided they were just going to leave him. But he was on an amazing mattress. This mattress was an airbag, and this mattress moved Derek from one side very gently to the other, and up, a little bit up and a little bit down. So it kept him moving. He still got some pressure sores, but on his back, but he did, he didn't get as many as he probably should have, thank God. So I had to call his brother in the morning, and that morning on the 24th in Montreal, and his daughter up in Huntsville, and basically tell them that Derek was dying. And Kieran, his daughter, I spoke with her mom as well, Colleen, and I said, I really think that Kieran needs to come down. She needs to see her dad, because I basically thought she would have to say goodbye to him. So Gordy couldn't travel from Montreal because there was no traveling between provinces. And she did. Kieran came down 20 years old with her mom, and I had to, prepare them to go in because I couldn't be with them inside his room. They wouldn't let people from different households be in the ICU room at the same time. So that was awful. But Derek rallied, and it was absolutely unbelievable. Whatever they threw at him, the doctor said to me, what do we do here? Because I had his medical power of attorney. And I said, just do whatever you can. And they said, okay, we do whatever we can. And they did. And so for 9 days, he was on the ventilator, and I would sit there reading to him, and they let me stay a little longer than 1 hour every day. And I'm still recovering, right? I'm still recovering from COVID. So I was still sick, not contagious, but I was still ill, as I still am. But it's, so you're on automatic pilot, right? There's so much I don't remember from it, pieces that I do. And then Derek got better. He rallied gradually, and they got him off that ventilator, and all medications reduced. But every complication in that second the second ventilation. Every complication the COVID patients have, Derek got. The lung collapse. He had the empyema. He had air in his pleural cavity. He had pulmonary embolism. So that's a blood clot. It's somewhere in the heart or the lungs, and they're not quite sure where it is. So they flood them with anticoagulants, and that can cause a stroke. So there's this balance between all the medication that they're giving you to keep you alive, but that medication can also kill you. So it's just the most remarkable people, the doctors, the technicians, the nurses. I can't say enough how remarkable these people are who cared for Derek and cared for me and the family through all of this. And he had, they said when he had the pulmonary embolism, which caused his heart rate to go crazy, he went into AFib, his heart was beating over 200 times a minute. The doctors told me that his heart could stop at any moment, apart from everything else that was happening with severe COVID pneumonia, that his heart could stop at any moment because it was under so much stress, and they would not be able to revive him. So all these unbelievable complications he manages to see through, and they get him off the ventilator, they bring him back to consciousness, and he's at Cordalucci then for quite some time, and he's in the he goes from the intensive care unit down to the critical care unit, and then he goes onto the medicine floor. And from the medicine floor, they then have to go to a rehab hospital. So what I didn't realize, and I'm coming to the end of the story, although there's still so much to tell, but these are just little pieces. What I didn't realize, like I said, I used to work in the medical field, so I'm pretty well versed with in medicalese, but I had no idea what prolonged critical illness, someone being in an ICU for an extended length of time, someone being on a ventilator for an extended length of time, does to the rest of the body. So the technicians, the occupational therapists and the physiotherapists would come to Derek, and I'm sure they did it at Mackenzie as well, I just didn't see it. But at Cordalucci, they would come in there 3-4 times a day. They would move his arms, his hands, they would move his legs. So you have, and now I understand what they were doing. It's not just, you're not just exercising, you're making sure that the blood is flowing properly. Sometimes you see people in ICU beds and they have these like balloon type things on their legs, and that is to force the blood back up to the heart. Derek didn't have to have that. But when he was finally stable enough out of the medicine unit, so he was there for about another 10 days, and then he was transferred down to the Toronto Rehab Institute, the Bickle Center on Dunn. It's just north of the Gardiner. And we were lucky he was sent there, because they told me at Cordalucci that he could have gone anywhere in Ontario and Manitoba. Thank God he went to Toronto. He could have gone anywhere for his rehab, because he has to go to a place that can take care of all of his needs. So he's transferred down by ambulance to Bickle. And luckily, we're in a different part of the pandemic, and now at Bickle I can see him every day, and I can stay there for as long as I want. So that, it's so much better. It's a schlep down there, but that's okay. It is what it is. It's very exhausting, but it is what it is. I have a day off. Today is my day off. So I get a day off so that I can also, tend to my own needs. So sweep the floors. So, what happened was Derek Derek started complaining that his feet had no feeling. They were tingling or they were numb. His feet had no feeling. And then when they were trying to stand him up, because as somebody said, I think it was Carol Chan, who said she's not on the screen anymore, and I'm so sorry that she also had terrible problems with her family. She said, I think it was her father-in-law or mother-in-law had to learn how to eat, speak, stand, and walk again. That's exactly what happened with Derek. He had to learn, I mean, just putting a spoon in his mouth was a major milestone. And then learning how to speak again and learning how to talk. And now he can speak, he can put words together in a sentence very, very well. So, but he started having these other problems when they would raise him to stand, and he's not standing on his own, he's just being raised to stand in a lift. They couldn't do it for more than about 3, 4, 5 seconds. And then he would just start feeling dizzy and nauseous and feel like he'd want to faint, throw up a couple of times, and he has to be sat down. So what's happened to Derek is that he's got a couple of other complications. And so one is known as POTS, which is Postural Orthostatic Tachycardia syndrome. So this happens to patients who have an extended length of time in an ICU or who are confined to bed for an extended length of time. When we get up and you stand, or you get up from a chair and you stand and you walk around, you don't give one thought to the fact that gravity is pulling down on the major veins and arteries in your legs, the blood, and your body has to work against that in order to push the blood back up through the legs into the major veins in the abdomen and get it back to the heart and lungs. That's what POTS is. So orthostatic patients are unable to do that because they've lost so much muscle mass that the body can no longer push the blood up. So they treat that with compression stockings, which Derek uses, and some medication. And Derek also, when Derek's, thank goodness, all the arrhythmias that Derek had while he was in his second coma, including AFib, that's all gone. But he does still have some minor issues with the heart, which are being followed. So he has that problem as well. And then he's also got what's known as critical illness polyneuropathy and myopathy, which is this, thank you, Marlene, which is this, they lose the nerves and the muscles no longer work on the extremes. It can be the hands and the arms as well. Thank goodness that's not with Derek. It's just his feet. So he's on other medication for that as well. And they will treat that. We don't know if it's ever going to go away. So we don't know if Derek's going to be able to stand, walk again. They've told me that they are pretty sure they will be able to get him to be assisted standing. So in a walker, and where he will use a walker where the arms are, where it's raised, so that patient actually leans on the walker and then starts to walk. But we're far away from that. He's in a very specialized wheelchair at the moment. So they said that they are pretty sure they will be able to get him to walk, but they don't know if he's ever going to be able to walk unassisted. So he will require enormous, we'll have to have enormous, outside help when he comes home eventually. And I don't think Derek will ever sing again. He doesn't have the lung capacity. His right lung never reinflated properly. His left lung did, but his right lung didn't. So he's got about 1.5 lungs. And by this time, into the period of rehab, that lung is not going to reinflate. So he has the top part of the right lung, but the middle and the lower, it just doesn't exist, just doesn't operate anymore. So I hope that one day he will be able to sing again. To hear him sing again will be amazing, that beautiful voice. He may sing differently if he can get enough air in order to sing again, but he's a lyricist as well, and he's a producer. So there are other sides to his music that he can turn to. He has three CDs that are under production, that have been recorded, that have never been released, of his songs and his singing. So that's, thank God we do have that. And he's very philosophical about it, as am I. And the most important thing is that he's alive. And we will go through whatever we have to go through. They've told us that it will be 2 to 3 years from this point on before we know exactly where Derek will be, barring any other further complications. And by the way, we had one this past Friday. So what's today? Tuesday? So this past Friday, so I'm double vaccinated now, thank God. Derek's had his first vaccine. He was supposed to get his second on Friday. They take 3 weeks between these highly susceptible patients. But on Thursday, he started feeling, and I'm going to write this in my update for Facebook today. On Thursday, he started spiking a fever. Just to cut a long story short, he developed pneumonia, bacterial pneumonia in his left lung. Terrible pain, terrible pain. He had to go on morphine. They had to start him on an IV drip. They were on the ball immediately. They realized that there was something, critical that was happening to him, because he once again, he decompensated very, very quickly. But they were on it, and they got him on IV antibiotic immediately. Pump that oxygen up. He'll probably have oxygen on also for the rest of his life. Pump the oxygen up, and literally within 24 hours into Saturday, he was already feeling better. Morphine was helping with the pain, but he was already breathing better. And they said that if this works, it's going to work very quickly. And thank God it did. So, when I was speaking to the doctor on Sunday, and we were discussing this, and, we live in such a different world now, and Derek and I inhabit such a different world, because what I said to the doctor was, oh, well, thank God it was only pneumonia. I mean, who says that, right? I mean, who says that? Well, it's only pneumonia. It's going to be okay. Really? But that's how you have to look at it. And they treated it so well. And now today, this morning, honestly, he's down to 1 liter of oxygen. He still has to be on IV antibiotics until Thursday, but his pain is gone. So we know that it's cleared up. He'll have a repeat x-ray. So he's still, what that also makes you realize how still compromised he still is, how still immunocompromised and fragile his health is. I mean, he's a 60-year-old, relatively healthy man. And, but this nearly killed him twice, and it will, without any question, change his life for the rest of his life. So we don't know what we'll be left with at the end. It doesn't matter. Even if Derek is in a wheelchair, it doesn't matter. He's alive. He is capable of, he'll be capable of taking care of himself. If we have to have a PSW here a few times a week, we will. But luckily we live in a condo. There's no steps. He can get around the condo really nicely. And his frustration does come through every once in a while. They have a lot of spiritual help there. Psychologists and all of that help him, help me. And in order to get through the emotional and psychological hit that this has on you. So his frustrations come through every once in a while, because he is still so dependent on the nurses, and he's still really bedridden. But they lift him up and they put him in his wheelchair. And apparently they were trying to do that again today. So he can sit in his wheelchair and he can at least have lunch sitting up. He can eat now. He's eating solid foods. So that's, all these little steps are major milestones. And it's a cautionary tale. I put it on Facebook because I was getting, people started to hear that Derek was ill and that I was ill. And I was getting so many people asking me questions about Derek that I just thought, you know what, it's just better to get this on Facebook so everybody can read it and see it at the same time. I have a family texting thing, an email thing that I do with the family every night, but family and close friends, but at least on Facebook. And I've had hundreds and hundreds of people respond. People I don't even know, people from overseas who's just seen these posts, and they're so thankful that I've been able to tell the story, because it's a story that everybody needs to know. This is how ill you can get. This is not the flu or like the flu. This is something completely different. And it will, if you are not vaccinated, and anybody who is an anti-vaxxer, I don't understand that mindset. They need to hear the story. They need to know what can happen to you, because even though we're double vaxxed, we're still at risk. Even though I had my first AstraZeneca shot, I still got ill, but I didn't go to the hospital. I wasn't in an ICU. I'm double vaxxed now, so I know I'm between, and I got my second shot was Moderna, between 92 and 96% protected, but I can still get sick. Derek can still get sick again. So again, we were talking about at the beginning, like, how do you deal with all these emotional and psychological side effects to all of this, right? And like I said at the very beginning, I don't know that I'm ever going to feel comfortable not wearing a mask outside, because it protects me from others who may be ill and don't know it, because it's the same thing. Before it was asymptomatics, now it's people who are not vaccinated and you don't know, and they could be sick and shedding the virus. And the Delta variant is, like I said, it's the Alpha variant on steroids, and it is so dangerous. And you can see all the numbers starting to climb again in the States, what's happening in Europe and Africa, and God help us, we will get there again. And I will tell you that the Bickle Center downtown is part of the UHN, right? The University Health Network. So a number of those hospitals downtown, they are all preparing for a fourth wave, because they know it's coming. They have everything stacked and ready to go. They have supplies of PPE, they have oxygen, they have everything. They have masks, medications, ICU beds. If they need field hospitals again at Sunnybrook, they will use them. But they are preparing for a fourth wave. So even though Canada is doing so well with vaccinations, and thank God we live in this country, and God we live in a country that can give us this most remarkable medical help, medical system, universal medical health for everybody. It is just remarkable. And there are so many others out there who have lost their lives, so many others out there who will have to deal with this for a very long time, or for the rest of their lives, like Derek. But he's alive, and he's going to be okay. And I'm going to be okay. My long haul symptoms will hopefully eventually go away. I'm here. I'm doing what I have to do. And it's all we can do is just, thank God, thank medicine, and thank science. And I want to thank you all. It's very cathartic for me to speak about this, because you don't really speak about it other than with my psychoanalyst or with people down at Bickle and the doctors and the nurses and friends and family. But I hope I've managed to give you just an insight into what catastrophic, life-threatening COVID illness can and will do to a human body. And it's mind-boggling. It's just, I never I never thought that we would ever experience this. You don't, right? But we did, and we will tell the story because people need to hear the story, and everybody needs to know that you've got to hear the story and know what can happen, because we could so easily have lost Derek, not once, but twice. So thank you again, Marge, for the opportunity to speak here. And thank you all. Thank you for your messages and your posts and contacting me. I love you all. You've been with me through 3.5 years of hell, never mind these past few months. And I can't thank you enough.